Matters.
It's American Heart Month, and our next guests are here to help us spot the warning signs of heart disease. We welcome back cardiologist with Providence Heart Institute, Dr. Lori Tam, along with Providence Heart Institute patient Kathy Reardon. Hi, ladies.
Hello.
So, Kathy, you have an incredible story. Your eye doctor is the one that got you going in the right direction to discover that you have heart disease. So, tell me about that.
Yes, he suggested that I go make an appointment and have a complete checkup because he thought that I was developing a cataract, and normally they're due to diabetes. And so I did make that appointment, and
Really?
The good news was I did not have diabetes, but after a series of tests, an EKG showed that I had a problem with my heart, and I was just shocked.
Right, because you're not overweight and you don't, and you were young, right?
And I felt fine.
Right.
Right.
How old were you when this all happened?
I was just in my early 50s.
That's so young. Okay, so Dr. Tam, so tell us about her diagnosis.
So Kathy had a cardiomyopathy, which is an enlargement of the heart. And as the cardiomyopathy progresses, patients tend to develop heart failure. They can also develop abnormal arrhythmias and rhythm issues that can predispose them to sudden death.
So what is the treatment for that?
So the mainstay of treatment are certain medications that we place them on to help the heart recover. In other patients, we often sometimes put in defibrillators or special biventricular pacemakers to help the heart recover.
So that's a pretty serious diagnosis then.
It is.
So Kathy, did you have any warning signs? Like looking back, do you now see that there were warning signs?
Looking back, about 4 years before this happened, I was walking uphill, and I had a funny feeling in my chest, a tightness in my chest, and it happened again. So
what did that feel like?
It was just a different feeling than I'd ever had before, and it didn't really like knock me over, but it just didn't feel right either.
But it just tightened
Yeah,
up and
just
caught
tightened
your
up.
attention.
Right, right. So the next time I saw my doctor, I mentioned it to her, and she thought I should have a stress test. And I was a working mother. I was also helping take care of my grandmother. I just never got around to having the stress test.
Oh, and so Dr. Tam, what are some of the warning signs that people can look out for besides the tightening of the chest?
Sure. So in addition to chest discomfort, some women describe it not as a pain, but as a burning sensation or a heaviness. But significant shortness of breath or trouble breathing is a warning sign. Also signs of fluid overload, like swelling in your ankles or trouble breathing when you lay down at night. Significant increase in weight over a short period of time. Palpitations like rhythm issues of your heart. Also being really dizzy or passing out. Those all can be signs of heart disease.
And so if people have any of those, could they be because of anything else, or do you think if they have any of those symptoms then they should go see their doctor and get a test?
Well, there's a lot of things, and some of them are benign that can give you some symptoms like that. But I think that if you're having any of those symptoms, really you owe it to yourself and to your family and your loved ones to really get evaluated by a medical professional so that we know it isn't something more serious.
Right, okay. So Kathy, what is your life like now?
Well, about a year ago, my husband was diagnosed with heart failure.
Oh no!
So we have had a renewed interest in eating right and exercising and reminding each other to take our medication. And have you taken your blood pressure recently? And we try to walk about 2 miles 4 to 5 days a week.
Oh, that's good.
We're following this Mediterranean diet, the Good Food, Great Medicine, by one of the doctors at Providence, Dr. Hassel.
Oh, great.
And so, yeah, we're doing great.
Okay, good. And there's an event coming up, isn't there?
There is. So there's a great Women's Wellness Expo that we're hosting tomorrow night, Tuesday, at the Base Camp Center for Prevention and Wellness at the Providence St. Vincent campus. And we're going to offer a number of activities, including women's wellness exams, a test for people to learn their cardiovascular numbers that are important for screening, chair massages and nutrition tips and education, mini yoga lessons. So we invite all of you to join us.
Oh, it sounds like fun, too.
Yeah.
Fun and important.
Sure.
Okay.
So more information at www.welcometobasecamp.org.
Okay, and we will have all that information on our website. So for more information about American Heart Month, just head to our Family Matters page at KATU.com, click on the Lifestyle tab, and then on the Family Matters icon, and there you'll learn tips for taking better care of your heart. Thanks so much, ladies.